Hello everybody, welcome back to the Whiteboard Doctor channel, where we attempt at least to provide some good free open access medical education, covering everything from EKGs to lectures on various medical topics to I'm hoping to do some live sessions where we can do some Q&As and maybe some case presentations as well. In any case, I'm rambling now. This is going to be a session on, I probably should have done it earlier before I started on the 5-minute EKG train, but it's going to be essentially trying to understand the, I guess let's say geometry, for lack of a better word, of a 12-lead EKG. So what each lead is showing you in terms of direction of cardiac depolarization and an anatomic association of each lead with the heart itself. It might be a little bit of a longer presentation. I'll give you kind of just a notice here on what rough section we're going to be talking about each thing, so you can skip ahead if you're just interested in one point. So we're going to be talking about the 12-lead EKG. All right. So as the name implies, the 12-lead EKG has, surprise, 12 leads. You can actually divide these 12 leads up into kind of two different groupings of 6. The first grouping is going to be the limb leads, and this actually can be divided up even further into, we'll give it an I there, the bipolar limb leads, which are going to be leads 1, 2, 3, and the unipolar limb leads. And we'll get into what this means here in a bit, which is going to be AVR, AVL, AVF. And then the second group of 6 is going to be the precordial leads, which are going to be V1 through V6. So why is this kind of differentiation important? It's honestly not extremely important, especially the bipolar versus unipolar, so I'll just try to kind of go into it rather quickly. It can be confusing, but stick with the video because it'll start to all tie together, kind of all builds on each other as we go through, and you'll start to understand a little bit more. So starting first with the limb leads. So as we said, there were the bipolar limb leads and unipolar limb leads. So to try to explain this point, I'm going to draw my best representation of two little bodies here. Could have been worse, could have been better. Same one here. Okay. I don't waste everybody's time attempting that. So we are going to have right arm, left arm, right arm, left arm, left leg, left leg. Okay, so starting first on this gentleman, we will do the bipolar leads. 1, 2, and 3. So an EKG, right, it picks up the electrical activity, and to pick that up appropriately, we need both a positive and a negative electrode, for lack of a better word, to pick up the electrical activity on the EKG. The bipolar leads essentially mean that there is a positive and a negative side that is depolarizing. So to kind of understand this, we will make a triangle on the body here, from right arm to left arm and down to left leg. That'll be in blue. Our depolarization for the bipolar leads, there is a firm area that's going to be a negative and a positive. So for lead 1, negative right arm going to positive left arm, and this is lead 1. So what that essentially means is any depolarization that's going in this direction will be a upstroke on the EKG. Lead 2, I will do it in a different color here. Let's do red for lead 2. So lead 2 is going to be also negative right arm, down to positive left leg, and this is lead 2, which means any depolarization in this direction is going to give you that positive upstroke on the EKG. And lastly, I guess we'll make it blue even though our triangle's blue, lead 3 is actually going to be a negative left arm down to a positive left leg, and that's lead 3. And again, bear with me. I will, essentially what I'm going to do is I'm going to build on each thing. So we'll add the bipolar leads to the unipolar leads, and then eventually to the precordial leads all on one picture, which is probably going to be the most helpful. So for the bipolar leads, they're bipolar because they go from a negative down to a positive, and you can think of it right arm to left arm 1, right arm to left leg 2, and then left arm to left leg 3. Okay, so then same thing for the unipolar leads. So the unipolar leads, right, they are AVR, AVL, AVF. They're called unipolar leads because they don't have, unlike the bipolar leads, they don't have like a firm preset positive and negative electrode spot. They use the middle area, and this will make more sense, of the other two leads as the negative and positive. I know that sounds confusing, but bear with me here and I'll show you what I mean. So for AVL, the direction of the depolarization always goes towards what the descriptor is. So AVL, there's obviously an L for left, so it's going to go from a negative to the left arm being the positive. So the negative area is actually in between the two. It just uses the middle summation to be the negative, and then it always goes towards the direction. So this is AVL, the positive going towards the left arm. For AVR, as one would imagine, it's going to be from the middle up to the right arm. So this is negative, this is positive, and this is AVR. And then AVF, if you think about it for a minute while I change my color here, negative to positive, so use the middle, down to the foot, right, AVF. So AVL goes towards the left arm, AVR goes towards the right arm, and AVF goes towards the foot, as the last letter would imply. R for right, L for left, F for foot. By underlying the F in foot, I made it look like an E. Okay, so all that confusion essentially just leads to this next moment, and I'm going to scroll down, and that moment is going to be that we essentially are going to combine both the unipolar plus the bipolar leads into a less confusing picture. So when we think about a heart, I'm going to quickly draw what's going to surely be a terrible heart. There's some atria, there's some ventricle, we'll call that the interventricular septum. Okay, so that is our heart. When we are looking at an EKG, instead of thinking of these bodies up here, that are really confusing, we can just give ourselves a middle point in the middle of the heart, and then look at all of our limb leads according to that point. So lead 1, one of the bipolar leads. Remember that was right negative, left positive, so it goes in this direction. So depolarizations that way will be positive. For the bipolar lead 2, if you remember, that was from right arm down to left leg. So in this direction, it would be positive. And lead 3 of the bipolar leads, if you remember, that was from left arm down to left leg. So this is going to look odd initially, but it actually goes in this direction. A little right of straight down, right? Because if we think our left arm down to left leg, right? All right, let me just erase these two abbreviations here quick. Okay, so now for the unipolar leads, they're a little easier to remember, right? Because they're essentially, right? So AVF down to the foot, AVL up to the left arm, then AVR up to the right arm. So these are our, it's not a D, 6 limb leads. All right, so halfway done. So what do we have left now? We have to talk about our precordial leads. Our precordial leads are essentially on the anterior aspect of our chest, so it's somewhat more 3D. So precordial leads are V1 through V6. You need to kind of think about this in a 3D sort of way. I will not draw kind of the body out as I did before because I don't think that's very helpful. I think what's most helpful in this case is, again, looking at this terribly drawn heart, interventricular septum, and then again, we'll put this dot. And this dot will give us a little bit of spectrum because we are going to make this right here is going to be a 3D ring. So picture this, it'll go behind the heart, the dotted line, that's a 3D ring around the heart. Okay? Our precordial leads help us with the anterior posterior. So if we think about this middle dot and these going straight out of the screen towards us, we have V1, V2, V3, V4, V5, and V6. There are exact angles between all these, but for the sake of this discussion, I don't think those angles are necessarily very important because we just need to know roughly where these are covering. So remember, these are coming out of the screen towards us. They're in the 3D plane. They're not going up and down like the limb leads. The limb leads all go north-south, while the precordial leads come out of the screen towards us. All right, so these are the precordial leads. Now I want to put all the leads together, the limb leads plus the precordial leads. So we're going to scroll down and we'll talk. This is going to be the image for our total 12 lead EKG. And for the sake of understanding, let's color code. What did I use up here? Let me see. So let's see. The unipolar leads were blue, bipolar leads black, and precordial leads green. So the bipolar leads were black. So I will say, remember, so these are going to be black on our drawing. The unipolar leads were blue. And remember, that's AVR, AVL, AVF, and then the precordial leads were green. And that is going to be V1 through V6. Okay, so let's do it. Let's put it all together. I intended to leave those in the screen for color coding, but I think I need a little more space. So we're actually going to scroll down and use all this space. Bipolar black. Let's just remember that. 2 and 3. Okay. So let's draw our heart again. I'm going to draw it a little bit smaller this time. We have our 2 atria. We have our ventricles with interventricular septum, right? Okay. So let's start with our bipolar leads. That's leads 1, 2, and 3. So our bipolar leads are going to go here. Guess what lead this is, right? So this is going to be left arm to left leg, which is going to be lead 3. Then we have this one here guess what this is going to be? This is going to be right arm to left leg. That's lead 2. And then our last bipolar limb lead, lead 1, remember, is going to be left or right arm to left arm. Okay, now we'll do our unipolar leads. So remember, unipolar leads are a little more obvious, right? So we have straight down towards the foot, so this is AVF. Then we have up towards the left arm, AVL, and then we have up towards the right arm, AVR. Okay, and the last piece of this puzzle is going to be those precordial leads. So I'm going to again draw, this is our 3D ring, and we're going to have V1, and remember, these are going towards us, right? This isn't going down like lead 3 is. This is going towards us in the anterior-posterior plane. V2, V3, V4, V5, and V6. So those are all of our leads. I think at this point I will give you kind of a little intro into another topic, but before I do that, I just kind of want to complete this thought here. So the 12 lead EKG has these 12 leads. It has the bipolar leads, the unipolar leads, and those are all limb leads, and those are all superior, inferior, right, and left, right? It's all in the vertical plane. Then the other 6 leads are the precordial leads, which are the leads that are going out towards us. When looking at an EKG, one can think of this in terms of how the heart depolarizes. So the heart, let's see, we'll use yellow, right? The heart, you have about your SA node, you have about your AV node, and you get this depolarization, right? Spreads, then it goes through this way and up this way. So when we're looking at our EKG and the heart is in a normal axis, which I will make a video on axis. Let me switch my color again so that you can actually see it. We'll make it orange. The P waves, right, have a positive deflection. This is our P. And if it is a positive deflection, it should be one of the leads that this depolarization is going towards. So what lead would have a negative P wave? And by negative P wave, I mean a P wave that goes down like this rather than up. AVR, right? Because in AVR, this depolarization is going in the opposite direction, right? That's also if you think of the QRS. So the QR is typically QR going down S. And it just depends on where you're at. So if, just like with P waves, if you're getting your depolarization towards that lead, so let's just talk about AVF quick. AVF is going to have, a nice big upright R, assuming that the axis of the heart is in the right direction, because that depolarization should be going through the ventricles right towards AVF and lead 2. So if you look at AVR and lead 2, should have a nice big upright one. Look at a 12 lead EKG and kind of mentally go through in your mind the P waves, the QRS in each lead, and then correlate that back to this drawing, because I think what you will find is that this anatomically and geometrically makes sense in terms of the depolarizations, the directions they're going, and then whether the waves are upright or downright. And once we understand this, we can start to talk about access, because access is essentially dependent on whether you have upright or downright deflections of your QRS in various leads, because the heart should be in a certain axis, right? This is kind of the general axis of the heart. And if your heart is swung or shifted, right or left, your QRS is going to be, higher up, lower, just depending on how much depolarization is going towards each one of these leads. But that'll be a different video, it won't be this video. The most important thing in this video was looking at this 12 lead EKG. I'm going to scroll back up to the top and we will just kind of briefly peek at everything again, right? So we have the 12 lead EKG, we have 6 limb leads, bipolar, 1, 2, and 3, unipolar, AVR, AVL, AVF, and then we have 6 precordial leads, which are in the anterior-posterior plane coming out of the screen towards us. As for the limb leads, the bipolar leads 1, 2, and 3 are based off of negative to positive. So right arm to left arm for 1, right arm to left leg for 2, and left arm to left leg for 3. The unipolar leads are based off of the middle point between the arm, right arm, left leg, and they are unipolar because they're going positively towards what they're describing. So AVL goes positive towards the left arm, AVR goes positive towards the right arm, and AVF goes positive towards the foot. So when you graph this out with the heart, it's easy to see here. Lead 1 going from right arm to left arm, lead 2 going from right arm to left leg, and lead 3 going from left arm to left leg. Whereas the unipolar leads AVR going towards the right arm, AVL going towards the left arm, and AVF going towards the foot. The precordial leads V1 through V6 are in the anterior-posterior direction, so these are all coming out of the screen towards us. When we graph them all together, and I kind of globbed up this picture now, we can see that the depolarizations, the upright and downright deflections of waves we see on the EKG are actually correlated to where the lead is placed and the direction of the depolarization. P waves are a good example. P waves are usually upright, but in AVR, right, because the deflection is going towards the feet, going opposite of the right shoulder, AVR, the P wave, is often downright, not upright, and that will lead us into access, which will be a different video I'll make. So I know this was a long one. It's complex. Please leave questions and comments below, different ideas for different talks, and then if you want to see how all this plays out on actual 12 lead EKGs, please subscribe, check out some of my other videos, and I look forward to seeing you all next time. Again, this is the Whiteboard Doctor, and appreciate you taking the time to watch.